Many people do not realize that the early signs of poor leg circulation can be very subtle. You might notice that your feet feel unusually cold, even when the room is warm. At times, there may be a tingling sensation, like pins and needles, especially after sitting for a while. Some people experience frequent muscle fatigue in their legs, even after light activity. Others may deal with sudden cramps, particularly at night or early in the morning. These signs are often ignored because they seem minor at first. However, they can be early indicators that blood is not flowing efficiently through your lower body. If you have been experiencing any of these symptoms, it is important to pay attention to what your body is telling you. Poor leg circulation becomes more common as we age. Many adults over the age of 50 or 60 begin to notice that their legs feel heavier or weaker than before. Walking may feel slower, and standing for extended periods can become uncomfortable. Simple daily activities, such as climbing stairs or getting up from a chair, may require more effort. In some cases, the legs may feel tired even without much movement. These changes can affect not only physical comfort, but also confidence and mobility. When circulation is reduced, the muscles and tissues in the legs do not receive enough oxygen and nutrients, which can gradually impact strength and endurance. One of the main reasons this happens is reduced blood flow. As the body ages, blood vessels can become less flexible, making it harder for blood to circulate efficiently. At the same time, many people become less active, which means the muscles in the legs are not being used enough to help pump blood back toward the heart. This combination of weaker muscles and reduced vessel elasticity can slow circulation over time. The good news is that there are simple ways to check your circulation and improve it naturally. Let's start with a quick 30-second test you can do right at home. Now let's begin with a simple test that can help you quickly check how well blood is circulating in your legs. This test is easy to do, requires no equipment, and can be performed right at home. It takes less than 30 seconds and can give you a general idea of how your lower body is responding to changes in position and blood flow. To perform this test, start by sitting comfortably on a chair with your back straight and both feet resting flat on the floor. Make sure your legs are relaxed and your posture feels stable. Then slowly extend one leg straight out in front of you, lifting your foot off the ground. Try to keep your leg at about hip height if possible, but only go as far as it feels comfortable. Hold your leg in this position for about 10 to 15 seconds. As you do this, pay close attention to how your foot and lower leg feel. Notice if your foot begins to feel cold, numb, or slightly tingly. Also observe any change in color. In some cases, the foot may appear paler than usual due to reduced blood flow. After holding the position, slowly lower your leg back down and place your foot flat on the floor again. Now watch how quickly normal color and sensation return to your foot. If circulation is good, the blood should flow back quickly, and your foot should feel normal within a few seconds. If you notice that it takes longer for warmth or color to return, or if the tingling sensation lingers, it may be a sign that circulation in your legs is not as efficient as it could be. Now that you have a better idea of your circulation, let's move on to a few simple exercises that can help improve it. The first exercise is called ankle pumps. This is one of the simplest and most effective movements you can do to support blood circulation in your lower legs. It is especially helpful because it directly activates the calf muscles, which play a key role in pushing blood back toward the heart. The best part is that this exercise can be done almost anywhere, whether you are sitting, lying down, or even resting in bed. To begin, sit comfortably on a chair or lie on your back with your legs extended. Make sure your legs are relaxed and your heels are resting on the ground or surface beneath you. Start by pointing your toes forward, away from your body, as if you are pressing down on a gas pedal. Then slowly pull your toes back toward you, flexing your feet so that your toes point upward. The movement should come from your ankles, while the rest of your legs remain still. As you continue, try to move your feet in a smooth and controlled rhythm. Avoid jerky or fast motions. Focus on fully extending and flexing your ankles with each repetition. You should begin to feel a gentle contraction in your calf muscles as they activate with each movement. This action helps stimulate blood flow through the veins in your lower legs. Perform this movement for about 20 to 30 repetitions, or continue for 30 seconds to 1 minute at a steady pace. You can repeat this exercise for 2 to 3 sets, depending on your comfort level. If needed, start slowly and gradually increase the duration as your legs become more accustomed to the movement. Ankle pumps are highly effective because they directly assist the natural muscle pump mechanism in your calves. When these muscles contract, they help push blood upward, improving circulation and reducing pooling in the lower legs. Regular practice can help decrease feelings of heaviness, reduce swelling, and improve overall comfort in your legs. The second exercise is called seated marching. This movement is slightly more active than ankle pumps and is designed to engage multiple muscles in your legs at the same time. It helps activate the thighs and hips while also supporting better blood circulation. Because it is performed while sitting, it remains safe and accessible, especially for older adults or anyone who prefers low-impact movements. To begin, sit comfortably on a sturdy chair with your back straight and your feet flat on the floor. Place your hands lightly on your thighs or hold the sides of the chair for balance. Make sure your posture is stable and your body feels relaxed before starting the movement. From this position, slowly lift one knee upward, as if you are marching in place while sitting. Raise your foot a few inches off the ground, keeping the movement controlled and steady. After lifting one leg, gently lower it back down to the floor. Then repeat the same movement with the other leg. Continue alternating between your left and right legs in a smooth, rhythmic pattern. Try to keep your upper body steady and avoid leaning too far backward or forward. The motion should be driven by your legs, not your torso. Perform this exercise for about 30 to 60 seconds at a comfortable pace. You can aim for 2 to 3 sets, depending on your energy level. If needed, start with shorter intervals and gradually increase the duration as you feel stronger. The key is to maintain a steady rhythm without rushing the movement. Seated marching helps activate important muscle groups in the legs, including the quadriceps and hip flexors. As these muscles contract and relax, they assist in pumping blood through the lower body, which supports better circulation. Regular practice can help reduce feelings of heaviness, improve endurance, and make everyday activities like walking feel easier and more comfortable. The third exercise is called heel raises. This is a simple standing movement that is very effective for improving circulation in the lower legs. It directly activates the calf muscles, which are often referred to as the body's second heart, because of their role in helping pump blood back up toward the heart. This exercise is slightly more active than the previous ones, but it remains safe and easy to perform. To begin, stand upright with your feet about hip-width apart. You may place your hands on the back of a chair, a wall, or any stable surface for balance. Keep your posture tall and your shoulders relaxed. From this position, slowly lift your heels off the ground so that you are standing on the balls of your feet. Try to rise up in a controlled and steady manner without rushing the movement. Once you reach the top position, hold for about 2 to 3 seconds. During this time, you should feel the muscles in your calves working to support your body weight. After holding briefly, slowly lower your heels back down to the floor. Avoid dropping your heels quickly, as a controlled motion helps engage the muscles more effectively and supports better circulation. Repeat this movement for about 10 to 15 repetitions at a comfortable pace. You can perform 2 to 3 sets depending on your strength and balance. If needed, start with fewer repetitions and gradually increase as you feel more confident. Focus on smooth, steady movement rather than speed. Heel raises are highly effective because they strongly activate the calf muscles, which help push blood upward through the veins toward the heart. This pumping action supports healthy circulation and reduces blood pooling in the lower legs. With regular practice, this exercise can help decrease swelling, reduce fatigue, and improve overall leg comfort, especially after long periods of sitting or standing. By now, you've learned a simple way to check your leg circulation using a quick 30-second test. This small step can help you become more aware of how your body responds to changes in blood flow. If you noticed any signs such as delayed color return, tingling, or discomfort, it may indicate that your circulation needs support. The good news is that the 3 exercises we covered, ankle pumps, seated marching, and heel raises, are designed to gently improve blood flow and activate the muscles that assist circulation in your legs. The key to seeing results is consistency. These exercises only take a few minutes each day, but over time they can make a noticeable difference. As you continue practicing, your legs may begin to feel lighter, warmer, and more responsive. Simple daily movement can help support better mobility, improve endurance, and make everyday activities feel easier and more comfortable. Always remember to move at a pace that feels comfortable for your body. Perform each exercise slowly and with control, and avoid pushing through sharp or unusual pain. If something does not feel right, take a break and allow your body to rest. If you found this routine helpful, consider making it part of your daily habit. For more simple and effective exercises designed to keep you active and healthy, subscribe to the channel and follow along with future videos.